This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
How stroke aware are you? You've probably heard us mention the warning signs before. Maybe you know someone who has experienced a stroke.
But you know what? It's never a bad idea to go ahead and brush up on your stroke awareness, especially since stroke will account for 140,000 deaths this year alone. Dr. Richard Bird is a neurologist at Peninsula Regional Medical Center, and he joins us this afternoon to talk about this preventable killer. Doctor, thank you for coming in. It's good to have you.
My pleasure. I always enjoy this.
Okay, so besides prevention, which is obviously a very important thing, I guess knowing what signs and symptoms to look for is pretty important, isn't it?
Well, we use the eponym FAST.
Fast.
Face, arm, sensation, and time.
All right, so
if you have weakness of the face, or speech rather, not sensation.
Okay.
So if you have trouble with drooping of the face,
okay.
Your speech is off, your arm is not working very well or weak, that's the most common symptoms of stroke. There are others, but those are the most common ones.
Those are the biggies.
So then you got to take
quick.
the time and move quickly, because time is brain, and the sooner you get to the hospital, the faster we're going to be able to do to maybe help reverse it, sometimes entirely, sometimes in part. But time is of the essence.
But you should not drive yourself to the hospital.
Correct.
You call 911?
That is correct, because some people are not going to make it. They're going to lose the ability to drive, they're going to become paralyzed, they're going to become unconscious, they may lose their vision. So no, they should not. And the ambulance people are well trained in how to do this, so they should not drive themselves to the hospital.
So we've been talking a little bit about the importance of early intervention, the T in FAST.
Yes.
How important time is. It's important to get in there as quickly as possible. Why?
Well, there has been out since the last 20 years the so-called clot buster drug, TPA. And the guidelines initially were it had to be given within 3 hours of the onset or when you were last known well.
Okay.
Well, that eliminated a lot of people.
Yeah.
The vast majority of people wake up with their strokes, and you don't know when it happened in the night. So they're often 6 to 8 hours behind, and you got a 3-hour time window, so they're immediately excluded. Well, over the last couple of years, they've increased that to 4.5 hours. But the longer you're out, the less the recovery you can expect, because there's more damage, going on. So the faster you reverse, the better. In the last several years, they've developed a lot of new technologies for clot retraction, where they actually take you to the special procedures room, put a catheter up into your arteries, and either suck out or pry out or pull out the clot that may, if it's a large artery occlusion, and you can go up and get it. Sometimes pulling that clot out helps reverse and prevent a lot more damage than you were going to get. For some people, it'll completely reverse it. For some, it'll only partially reverse.
Right. I feel like we jumped into the middle of the conversation, so my apologies here. When we're talking about a stroke and you're talking about clots, tell me exactly what a stroke is.
Okay. A stroke is what they call an ischemic stroke, is when you've plugged up an artery and the tissue that artery feeds now dies.
Okay. All right.
If it happens in the heart, that's a heart attack.
Gotcha.
If it happens in the leg, that's gangrene. If it happens in the brain, it's a stroke.
It's a stroke.
So often it can be a large vessel from a clot, either from the vessel itself that went up north, or actually coming from the heart or the aorta that went up north and blocked the large artery, which can cause a very large, sometimes lethal stroke.
So that's why you say time is brain.
So the sooner we can get that out, if you're the right candidate and that's your problem. Many strokes can be very small capillary strokes, so little tiny blood vessels deep in the brain, very common in hypertensives and diabetics.
Right.
Those are the little ones. We can't go get those. But if you have a large artery stroke, we can go off and fish that out. And we have new technology at the hospital and new staff that can do that, and a whole new operating room they've set up just for that.
Okay, well, we mentioned when we were starting this that it is preventable. So let's talk about preventing the stroke to begin with.
So the best way to prevent it is control your risk factors. And the risk factors are well known. Hypertension, number one. And hypertension, I think, is increasing to some degree because Americans are getting bigger. That's the number one. Diabetes is a common contributor. Lipid problems, cholesterol, and triglycerides both. Triglycerides actually have a higher incidence of stroke than sometimes cholesterol.
Right.
Smoking.
Don't do that.
Heart disease.
Yeah.
Positive family history, but almost has that.
That was my next question. Does family history play into this too?
Yes, because most people get their blood pressure, diabetes, and cholesterol problems from their parents. That's usually a genetic disorder. And you get that because your parents passed it on to you. So the better you modify your risk factors, keep your weight down, keep your blood pressure as perfect as possible, keep your diabetes under as tight as control as possible, significantly lowers your rate. A lot of people get cavalier with their blood pressure of not bad.
Right.
Not bad just moves the stroke up another year or two.
Yeah.
Okay, so that's you just spit out a whole bunch of
Yes.
information.
Yes.
So if there is one thing that the viewers can take away from this, what do you think that is?
Follow up with your doctor and make sure your risk factors are under his control. Do not get lackadaisical about it, because you will pay for that down the road. The better you control your risk factors, the better you're going to do.
It's preventable.
And a recent thing that's come out is diet.
Right.
Some studies have shown that, well, we all know American diets are not good. We're far too fatty. But the Mediterranean diet, which uses olive oil and a lot of fruits and vegetables and not very much meat, has been shown to be the most significant dietary reduction in stroke. It reduces your stroke risk 40%.
Wow.
Something
That's
to look
impressive.
into.
We're learning a lot as we go, aren't
That's
we?
impressive.
That
Yes.
is impressive.
Dr. Richard
Bird.
Bird,
Thank you.
neurologist with Peninsula
you.
Regional Medical Center. Thank you so
Thank you.
much. Good
Enjoy.
information.